We're just going to go over a few things regarding posture, standing posture, and sitting. When you're sitting down, posture for that. Part of it is good for your neck and your back. The other part is you just look better when you're standing up straight and you're sitting up straight. Good for your breathing, just overall. So let's talk about, if we're going to go from the bottom up, okay? The first thing we want to think about, some people talk about top down, I'm going to go bottom up. So bottom up and standing here, we want to think about a relaxed knee position. So you want to have your knees not locked out. You want to kind of have them straight and soft. My friend Linda Lancey, personal trainer, great lady, she showed me a little bit about it called soft knees. So we shouldn't be locked out and hyperextended, because what typically happens is up the chain, it affects our back position, our pelvic position too. So I want to start off with the first position is a comfortable stance, relaxed knee position, not locked out. Then once we get to there, we want to build on there. We want to try and keep our position as far as a neutral position. All that means is we don't want to be sub forward, which makes your stomach look even bigger. And we also don't want to be flattened, okay, and kind of pulled in, all right? So we want to get somewhere between this position, which is I call posterior tilt, or an anterior tilt. Either way, too much of either direction is not particularly good for you, okay? And it'll stress the ligaments in either side, some of the bony structures as well. So first of all, set our knee position, and then we want to kind of rock between this tilt position forward, where our bones rock forward, and slightly back. So let's get to that neutral. All right, so once we have our knees set, we have our pelvis set here, then we want to look at our upper back. So we can have this all set correctly, but if we're forward like this in the thoracic, which is this area of the spine here for our skeleton right here, the thoracic right here, if we're tilted forward, over here, those dowager's hump, that little hump that people will get, unfortunately, when they get a little older and forward, we want to make sure, once we have that position, we kind of pull that sternum up, pull our chest up, so we have a good straightening through here. A lot of people will get confused with pulling their shoulder blades back and saying, well, I've got good posture, but they're not changing the orientation of this part of our body and getting that a little straighter, and that's where we got to kind of get our foundation. The other part then is getting an orientation of our ears over the tip of the shoulder. Now, if you have lost some motion in certain directions, let's say you can't arch as much, you've lost some motion here, or you have some tightness in the hips, even the knees, that can affect your ability to have good posture. Some of my patients will say, I'm trying to stand up tall, but they don't have the adequate range of motion to do it. Sometimes at their neck, like I have a tight neck, sometimes it bothers me more than others, and I can't quite look up as far, and that affects my ability to keep myself upright. Same thing with the lower back. Some people will lose their ability to arch. Like good range of motion for the lower back is being able to go all the way back to here. Some people come in here and they literally can't get past, I call neutral. They literally can't lean past here. Can't do the limbo. So we want to make sure they have adequate range. So if you're trying this at home and you're saying, I just can't stand up tall, you might have some range of motion loss and it really can't help you out. But if you can get the posture better, it's better for speaking. You look better if you're a little bit more upright, okay? So think about some of those things as far as your standing posture. You can go, a friend of mine has talked about posture from the head down, decided to talk about posture from the ground up, okay? So that's standing posture, all right? So if we have adequate range of motion in our skeleton, we're just trying to get everything to load evenly. So if we're looking at the spine here, our other spine here, this is a normal curve. All right, and all we're trying to do is get everything in this area of our spine to be loaded evenly, so we don't have like a tilted foundation. It puts more stress if it's excessively extended or excessively flexed if we're like sitting down. So that's the whole goal with posture. It's supposed to be kind of a neutral position, a good safe position. It doesn't guarantee you won't get hurt or have neck or back pain, but it's a good start, and you just look better. It's funny, you talk about breathing and such. When I have some calls, a lot of times I'll stand up actually during the call. It keeps me more alert. I got a better breath. I come across better. So just some tips there. And you just look a little better. So anyway, so that's standing posture. Okay, that's a few tips there. Let's go talk about seated posture. When you're sitting down here, let's go over a couple things as far as a starting point. This is a lumbar roll, which we'll explain in a second. But when we're in a chair here, we want to have our legs, kind of our thighs in contact with the chair, our legs at right angles. Some of those chairs that you can adjust up and down are really helpful to, get you at the right height. But I think the biggest mistake is how we orient ourselves in the chair. We want to get back as far as we can into the chair and then lean back. If we're kind of forward like this, we tend to create that C like this. It tends to put our neck a little bit more forward, especially as your sight's going like mine's going. And it tends to pull you more forward like so. Okay, but what you want to do is get back into that chair as far as you can back. And when in case of using some of these rolls, these what are called lumbar rolls, it just means the area of your back. This is the lumbar region. We use these rolls. This is a one size fits all, meaning it fits for some people, but doesn't fit for all. You want to use this roll, you want to get back as far as you can. You want to lean forward, get the roller nice and low right here, and lean back into the roll. Now, when people don't, they say, these rolls don't, help me. Sometimes they don't help you because it's just not going to help your type of back problem. But a lot of people use these rolls, they put it too low, and they're really not getting for that little indent. That's all we're trying to do is support that little indent in your lower back and maintain the normal curve. So we have the roll too low, and we're kind of sliding forward. If it's at our buttock, it's not going to support that normal curve in the lumbar spine. So we want to make sure it's up high enough. And also, even when it's up, some people will be too far out, and they really are not getting that support. It's there, but it's not really doing anything, okay? So we kind of get it back as far as we can, sit in here, and lean back into that position. You can see a little bit from the side view. I know it's a little hard with the armrest here, but that little lumbar roll is supposed to be in that slight curve, okay? Now, if you're in a position where you're in unsupported sitting, where you're, let's say you're watching a football game or something where you don't have a backrest, those are a little harder situations. So one of the things I'll tell people to do is I'll say, when you're getting to the end of if you're sitting in a seat like so, is you can work on this at home, is work on that tilt that I was talking about, that tilt forward and back, and kind of get that motion so you're getting a good foundation when you're sitting up and watching whatever event you're looking at. It's hard to hold that position without the back support, but at least getting aware of what's the right position. Last thing I'm going to leave you with is a good postural exercise called a slouch correct. And slouch correct is basically getting into a slouch position in which some people feel is normal. They actually say, this feels normal for me. And then you have them slouch and then correct. And all we're doing is rolling those hips forward and trying to get that ear over the tip of shoulder, over the tip of the hip position. So I'll have people just slouch and then correct. And I'll give people a little cue. I say, no, I want you to arch a little bit more. I want you to bring your head back more. And some people say, this feels so odd. This doesn't feel right. This feels like this is just not, they almost tell me that they feel like they're leaning back too far when they're actually just nice and upright. So we'll work on that in addition to some range of motion exercises that help you get into the position. But don't get frustrated. If you feel like you really can't get into those positions, it might be truly that you have some tightness in your hips, your lower back, your neck, your upper back, and there's a bunch of stretches that you can do for that that'll help you. But try and do that. Some of it is just truly you don't know, it doesn't feel normal, and you have to figure out what's the new normal for you. And that's why posture is so hard. So I hope these tips help you out. That exercise was called a slouch correct. And we're going to be going over all the tips in future videos. If you like this, please subscribe or like this video. And I wish you well. And any questions, please put it in the comments and share with your friends. Okay? Thanks so much for tuning in. I hope you got something out of it.